I'm coming to the room. I'm gonna check for my safety. It's safe for me to approach. Good morning, Jim.
Good morning.
My name is Cynthia, one of the nurses, and I came here to talk about your dress. Is that okay?
Yes.
Before I proceed, I'm just gonna wash my hands, okay?
Okay.
So I'm gonna apply water and soap, and I'm gonna wash my hands in the 7 steps of WHO. So palm to palm, back to hand, fingers interlace, fingers interlock, rotation of thumb, tips of fingers, wrist. Gonna rinse, close the top using my elbow, and I'm gonna dry. So I'm ready. Jen, before I proceed, can you please tell me your full name?
My name is Jean Antoni.
Okay, and your date of birth?
020262.
Okay. It's okay if I cross-check with your wristband?
It's okay, go ahead.
So I have here Jean Antoni, date of birth 020262, and X number 123646. I'm happy that I have the right patient. So I understand that you have a dressing.
Yes.
It's in your tummy?
Mm-hmm.
Okay. When was the last time you changed it?
I was changed 2 days ago.
Okay. And one more question. Are you allergic to anything?
Not that I know of.
Any food allergy, any medication allergy, or dressing allergy?
No.
Okay. Are you in pain now?
Right now I'm okay. I'm not in pain.
So what do we need to do? I'm checking your prescription. We need to change the dressings due for today. So I'm just going to remove the dressing you have now. Clean with saline solution, which is you should suppose not to feel anything. Dry and put another dressing on top. Is that okay?
It's okay.
Are you feeling comfortable? You're going to take about 10-15 minutes. Can we do this about now?
It's okay, yeah, we can go ahead.
Okay. So I'm just going to send my equipment. They're going to come back for you to change your dressing, okay?
All right.
So I'm leaving the room. I'm going to perform my hand hygiene. And I'm going to send my equipment. Let's check my prescription. I have here Maripor, which is the correct dressing. And the saline solution is the prescription to clean my wound. So first thing, I'm going to clean my trolley. I'm going to take my box of wipes. It's intact. It's in date. And I'm going to clean my trolley on the top shelf. In S motion, farthest to near me. And I'm going to discard in the 3 equal ways. Take another one. Clean the sides. Discard in the 3 equal ways. Take another one. Clean the bottom shelf. It's going to be my bottom shelf in the S motion as well, where I'm going to put my equipment. So I'm going to perform my hand hygiene again, and I'm going to send my equipment. So first thing, I need a pack of wound care. This one is intact, it's in date, it's dry, it's dry, and I have to use this one. I have the Maripor, which matches with my prescription. It's intact, it's in date. I have to use this one. Saline solution, intact, with no sediments. I'm gonna put an extra gauze in case I need. Alcohol swab, which is intact, in date. My gauze is intact and is in date as well. And I'm gonna put an extra pair of gloves in case I need. This one is my size, which is intact and it's in date. So is everything in my bottom shelf? I'm gonna perform my hand hygiene again, and I'm gonna come back to my room, not touching the top part of my trail. So hi Jim, I'm back. How are you?
Hi, Cynthia.
So I'm closing the curtains. I already closed the window and turned off the fan. No one gonna disturb us now. Is that okay if we proceed?
Yes.
So I'm gonna perform a hand hygiene. And I'm gonna do my Jean, it's okay if I expose the side of the wound?
It's okay.
So I'm checking the area around the wound. There's no sign of allergy, there's no redness, no sign of inflammation in the skin around. So I'm just gonna remove the tips of my dressing. To keep your wound healing, Jean, it's important to have a balanced diet, drink a lot of water, and try to walk around the floor as much as possible. Mobilize is very important, okay?
Yes.
It's okay if I call you Jean?
It's okay.
So I perform my hand hygiene again. And I'm gonna prepare my equipment, which I already checked. So let me just put it here that you can see what I'm doing. I'm gonna open my pack. Discard this in a domestic waste. I'm gonna perform my hand hygiene again, and I'm gonna open my packet. So just touching the tips. The things that I need. I'm gonna open my dressing. I'm gonna take my wipe, and I'm gonna clean my saline solution for 30 seconds. Assessor, can I assume 30 seconds have passed?
Mm-hmm.
So I'm gonna allow to air dry for 30 seconds. Open. And I'm gonna put in my trail carefully. And I'm gonna take out I'm gonna perform my hand hygiene again.
Mm-hmm.
Open my head. So now I'm gonna organize my things around. I have everything that I need, so I'm just gonna remove my dressing. How are you feeling, Jean?
I'm okay.
You okay?
Yeah.
You're not supposed to feel any pain, but if you feel anything different, please just let me know, okay?
Okay.
So my wound is exposed. It's clean, as I can see. There's no discharge. There's no infections in signs. So I'm gonna perform my hand hygiene again. I'm gonna take my other glove. luvas estão em guerra hoje. The gloves are in a war against us today. It's a war. So I'm gonna take my stereo can, stereo field, and I'm gonna put here without touching, just to protect this area and expand my stereo field. Can touch this part because it's not contaminated with this card. So now I'm gonna open my dressing while my hand is still clean. Take my gauze, dip it in the saline solution. This is my clean hand, this is my dirty hand. I'm gonna clean in one motion and discharge without touching anything. Taking another one, and I'm gonna clean. Try not to interfere in the healing, so I don't need to rub the wounds so much. So it's dry, I'm happy. I'm just gonna take my dressing with my clean hand.
20 seconds.
How much?
20 seconds.
20? Okay, I'm finished. I just want to document the dressing. There's anything else that you need for now?
No.
No, I'm gonna just discard this in a clinical waste. Make my hand hygiene. Remove my apron.